SNIC Rehab Foundation and Child Rehab Center. So we are again excited here to be with you all with a great knowledge and lots of different perspective you are getting here. So I will not take much of a time, but I want to go through few things that new parents are joined, so they should know what are these two organizations are working. So just briefly, I want to tell about SNIC that myself, Harshali Kharche, I am the mother of two kids who are those are on spectrum, and I'm the founder and the director of SNIC Rehab Foundation. My vision is to empower parent. Basically, I want to show them the right path. They should not go anywhere else and anywhere else in a wrong direction. I'm just connecting the good professionals to the parent. So this is my main mission in this. So in for that mission, I'm working on various programs like awareness programs, parent empowerment programs, financial advisory program, and mainly community support. Whatever they want, all the parents, because I gone through that pain and that journey. So I want to help each of you with that my little bit knowledge, and I have professionals today. So I will go on that. So today we are here for the part 3 of autism treatment from diagnosis to independence. In last two webinars, we have gained so much of knowledge that like I don't want to say much of it, but those who attended last two webinars, they know how much it is helpful. And those who missed those two parts, they can go on the YouTube channel of CRC or SNIC. You can find those tools, so you can link those or you can take advantage of those things. Right. So today we are here with Dr. Sumit Shinde sir. He is a pediatric occupational therapist and rehabilitation consultant. He has more than 18 years of experience in pediatric rehabilitation field. Also, in so many years, he has seen more than 10,000 children in his career. I mean, can you imagine 10,000 children? So, right, that much experience he has in this field, and that's why, like, he has got various award winners. He has got Indian Icon of the Year 2019 and Youngest Achiever Award in 2020, and many more actually. I don't. I mean, if I list down, so I'll take another 15 minutes to say his achievements. There are so much achievements, but related to parent, I will tell you one thing, that he has been working with an intention of integrating our children in mainstream society. That is the main intention that I am attached to this organization, like as a parent, because what we need finally, we want our kids to be integrated in the society. So for that matter, his intention is our life's vision. So with that thing, I would like to invite Dr. Sumit Shinde for today's webinar. Welcome, sir, and over to you. Thank you. Thank you, Harshali. So today, okay, before I start, let me know the audience. So, how many of you did the last two webinars or last webinar अपने जो treatment approaches का attend किया है? Or how many of you attended the last two webinars or last webinar? I just want to know. You can put your responses in chat box. Please use the chat box wisely and be active so that we know that you are listening and you're in tune with sir, please. I received So I received a few calls in last week about thanking about about what parents were feeling. They shared their feelings with us. We got a call from Anna received few calls.
कि what parents were feeling and what parents were doing, uh, and how they got came to know कि what is the difference between various treatment approaches. So अब तक so far I mean, those who missed my community, just now I conversed with one of the participants about what is this webinar about. So for the new people, let me place it in this way: कि, uh, last 17, 18 years of my career, when I started with the pediatric occupational therapy uh, uh, career, uh, I I have seen various dimensions of various dimensions of autism treatment practices happening, problems in the schooling, various problems, what parents are facing, uh, change in the structure of treatments. 15 years back, the structure of treatment was different, parenting was different, professional aspects was different, and today in this digital media, digital thing, Google is giving everything. Now ChatGPT has come, everything is coming with. The dimensions of treatment have changed. What not changed is our concerns, and our concerns is all about what will happen with my child and how I can improve my child, how I can improve this condition. So this webinar is all about from diagnosis to independence. Is all about, first of all, understanding the path where we are. हम लोग ये अंडरस्टैंड करने के लिए कि हम कहाँ पर हैं, ट्रीटमेंट क्या चल रहा है हमारे 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 बच्चे का, या हम लोग एज अ प्रोफेशनल्स क्या ट्रीट करते हैं. So based on that, actually called me, can you, we would like to know your views on various things. So I said, okay, I am working on something new. So let me explain you what all my experiences and observations over past 15 years. And मैं आपको एक फर्स्ट 15-20 मिनट्स में आपको ये कहना चाहूंगा. आई वुड लाइक टू आस्क यू कि कम आउट ऑफ दैट ऑटिज्म and I will come out of my profession. And let's look at this field from the top quarter. Okay. From what is happening in this maze. Because of जब maze में होते हो, when we are in a maze, we don't know कि where whether we are right or wrong. We all are in a maze and everybody is trying to help each other over there. You know, but only those people understand who are out of the maze, that who's doing what and what is happening around. So when I come out of that maze, when I come out of that professional aspects and I look at a life, I look at lakhs of hours I put in this. So I classified whatever the treatment is happening in autism. मैंने क्लासिफाई किया है कि ऑटिज्म में जो भी ट्रीटमेंट होता है उसको मैंने 3 मेजर जो एरियाज है उसमें विभागने की कोशिश की है. So this way, I have the first one was autism treatment maintenance approach. Second is autism treatment training approach, and third thing is autism treatment developmental approach. In mental maintenance approach, uh, many parents and professionals actual center of attention, attention is towards improving the behaviors, or towards improving the child in comparison with other kids. He is not sitting in the class, so he should sit in the class. Or he's showing some behaviors, stereotypical behaviors, so he should stop the stereotypical behaviors. And major time, lots of time goes in that managing the behaviors. Important age. Child was diagnosed at the age of 2.5 years. 2.5 साल में उसका डायग्नोसिस हुआ है और अभी वो 7-8 साल का हुआ है. Still the parents and the professional is working on managing the behaviors. Okay, where the development has not gone up. Okay, only things are going down, so some things are popping up. वो जो पॉपअप हुआ उसको ठीक करने के पीछे पड़े तो और कुछ नया बिहेवियर आया हर इंसान की वर्किंग से ऑटिज्म इज नॉट ट्रीटेबल. So that is all about maintenance approach. I have discussed in my previous webinar. You can go through those. It's on YouTube, so you can go through it. Maintenance approach is all about cosmetic approach. It's all about symptomatic approach, in which, in like malaria, what we see is if a person is showing symptoms of fever with chills, you know, तो अगर कोई वो सिर्फ फीवर को ट्रीट करने की कोशिश करे 10-12 दिन, तो शायद 12वें दिन वो इंसान क्या होगा. अगर सिर्फ फीवर को अगर हमने ट्रीट किया तो व्हाट विल हैपन, कैन यू प्लीज पुट इन चैट बॉक्स. सपोज इफ यू ट्राई टू ट्रीट, सिर्फ उसको पैरासिटामोल दे दिया उसके फीवर को ट्रीट करने के लिए, या सर दुख रहा है उसका तो उसको हेडेक की कुछ दवाई दी, तो व्हाट विल हैपन आफ्टर 12 to 15 days. कैन यू प्लीज पुट इन द चैट बॉक्स. Or can say, I mean, we can say the time. I will ask you, Arshali, what will happen? I mean, you are from a doctor family. So suppose अगर मलेरिया को सिर्फ फीवर को और सिर्फ हेडेक जो हो रहा है, ओके, सिर्फ उसकी दवाई दी तो क्या होगा? What will happen?
फीवर तो जाएगा नहीं, बिकॉज इन्फेक्शन जो मेन है वो तो रहेगा ही बॉडी में.
Exactly. सो फीवर जाएगा नहीं, शायद जाएगा नहीं जाएगा ये मैटर नहीं करेगा, लेकिन वो 12वें दिन के बाद वो जो पर्सन है वो आईसीयू में डेफिनेटली रहेगा. बिकॉज मलेरिया इज नॉट फीवर, इज नॉट हेड. मलेरिया इज ऑल अबाउट इन्फेक्शन इनसाइड द बॉडी एंड बॉडी इज रिएक्टिंग टू इट. बॉडी का एक खुद का एक प्रोटेक्टिव मैकेनिज्म है जिसमें से वो दिखा रहा है बॉडी लोगों को बाहर कि इट इज फीवर या हेडेक हो रहा है. तो सिम्टम इज नॉट डायग्नोसिस. No? तो मोस्ट ऑफ द पीपल जो डायग्नोस सिम्टम्स को डायग्नोसिस बोलते हैं वो लाइफ टाइम मेंटेनेंस अप्रोच में रहते हैं. देन इंपॉर्टेंट वेरी प्रेशियस टाइम ऑफ अर्ली इंटरवेंशन और मिडिल एज गोज इन बिहेवियर मैनेजमेंट. सेकेंड थिंग इज ट्रेनिंग अप्रोच. Training approach is all about child is not doing this, so I will use various noble approaches to train him to write, to read, or to sit, or to speak, or to behave, or social skills. I will train him. Say hi, say bye. When the child wants to say hi or say bye, that doesn't matter. Lots of training approach without understanding whether the child's inner drive is there or not, without understanding whether the child has developed adequate social interaction ability or not, or without understanding whether the child has developed receptive intention, receptive communication or not. So that that is kept around aside, and most of the professionals and parents will keep training the child. In that train, child's inner ability is not there, inner learning ability is not there. So then bombardment of things keeps happening, and there are few parents who feel कि बच्चे को बहुत ज़्यादा parents professionals. It's not about parents and professionals. I have already asked everyone to go out of this field and let's look at what is happening in autism and treatment, and us, with all of us, what is happening in this field and how this field is actually going ahead. So few parents feel कि बच्चे को जितना ज़्यादा हम लोग engage रखेंगे उतना ज़्यादा बच्चे अलग अलग स्किल सीखेगा. लेकिन अगर लर्निंग एबिलिटी टिपिकल बच्चे से अगर 20% कम है, 40, 50, 70, 80% कम है, तो उस लिमिटेड लर्निंग एबिलिटी में हम कैसे बहुत सारी एक्टिविटीज उसके ऊपर बॉम्बार्ड करेंगे. और बहुत सारी एक्टिविटीज वो ऐसी हैं जिसमें शायद डेवलपमेंट में बच्चे को शायद उसका उपयोग या उसका यूज नहीं होने वाला है. लाइक व्हाट विल हैपन चाइल्ड पुट्स द बास्केटबॉल इन द बास्केट. It's not going to work. Recently the movie has come, the Sitare Zameen Par. It's all about a basketball, but it's not about basketball. It's about those kids' social skills. It's about what those kids are communicating from the inner drive, how they are expressing their emotions, how they are expressing their learnings, how they are learning from the different environment, and majorly how they are getting the intentions of others in any given environment. So Sitare Zameen Par is not about basketball. वो बच्चे को ट्रीट किया गया. Many parents have said कि okay, basketball is a treatment. No. It's all about how those kids have reached to interact, to communicate, even though they were having some kind of issues. In fact, they were not autism, they were, इसमें से एक ही बच्चा autism था. Okay. I think Harman knows many of those kids. So this training approach is parents बहुत ज़्यादा training में जाते हैं and then बहुत सारा टाइम, बहुत सारा इम्पोर्टेंट चाइल्ड एंड पेरेंट कनेक्शन उसमें लूज होता है. स्टूडेंट्स आर रेडी फॉर दैट ट्रेनिंग. चाइल्ड डोंट नो कि व्हाई आई शुड डू इट. अगर मैं ये क्यों करूँ, अगर ये मुझे पता है तो मैं वो इनर ड्राइव से करूंगा, लेकिन क्यों करूँ ये पता ही नहीं है, उसका उसका ओरिएंटेशन नहीं. तो मैं चाइल्ड बिकम्स अ ट्रेन्ड और थोड़ा सा रोबोटिक ट्रीटमेंट, रोबोटिक डेवलपमेंट होती है, और उसी को हम लोग कहते हैं कि हाँ ऑटिज्म में बच्चे की डेवलपमेंट ऐसी हुई. ये दो अप्रोच, लाइक मेंटेनेंस अप्रोच, second is a training approach, and third thing which I'm come across and which I believe in since many years, almost 8-9 years. I mean, अगर कोरोना के टाइम, कोविड के टाइम अगर ऐड की, almost around 10-12 years since 2012-13. I as a professional started feeling that whatever I'm working on is not about development. One of the WhatsApp group, uh, we were, many parents were there, and उसमें एक 10th का बच्चा था, उसका मैं नाम बदल के बोलता सोहम, लेट अस से. एंड सोहम की मम्मी ने वहां पर डाल दिया कि माय चाइल्ड got 64% marks, and I'm very happy that he got 64% in SSC boards. Or everybody was happy. I was also happy. I was knowing that child. Why? But over there, the the parents started congratulating. Parents started becoming more happy, and it's a wonderful thing that one child is developing, so everybody becomes happy. Few started congratulating. Later on, some weird questions started coming. Which school you went to, or which teaching techniques you did, or which therapies you did, or did you do this, did you do that? And I thought that communication is going towards wrong direction, because there were many parents whom I was knowing that they are actually not in that frame to ask those questions, because their kids were very much different. So I asked this question to Som's mother that congratulations Som, like he completed his 10th standard, and it's an amazing achievement. But I would like to ask you a few questions. When there is nobody at home, is he able to manage alone at home? Because since he's 16 years old now, okay. When suppose some emergency happens in the home, does he take help from the neighbors? Can he cross the road? Can he go alone to by rickshaw? Can he commute by auto rickshaw, or by this things, by even if he has money, can he commute? Can he go somewhere else? If you live in 100 to 200 meters away from this thing, can you come alone? No, are you confident that you will come from any place? There are many more questions. Suppose अगर घर में अगर fire होती है तो वो क्या करेगा? What he will do? You are not well. Can he call doctor? Can he call father? Can he call neighbor? And like 15-16 questions I asked, and then there was a big silence on that group, and nobody put any post. And after 3-4 hours, I got a call from the mother that I was searching for these questions. I was searching for these questions. I was searching for these questions, not answers. I was searching for these questions since many years. And that how I can make my child independent, or what is exactly the development. And now you created those questions in my mind, and this nobody told me. Everybody told me school में जाना है, पढ़ाई करना है, शादी टीचर करना है, writer देना, everything. Because I asked questions and this thing, but nobody told me how to ask right question. So my child doesn't do anything out of it. He is very much supported by me, and without me he cannot live alone. That was the time that me and my team started working on, because where we can help the child to be independent in the life. So to be independent in life is all about how he can be first the child is supposed to be a part of family. then he's supposed to be a part of around and surround environment, then he's supposed to be a part of society, then he's supposed to take decisions, he's supposed to be oriented, he's supposed to be thinking, imagining, he's supposed to be emotional about what others are going through, what he's going through, he's supposed to express his emotions. And number of things are there in the developmental approach, but most of the time, like malaria, we keep treating the fever. Like in autism, people keep treating the behaviors, and in comparison, keep treating the child like other kids. Keep training the child, and most of the time, after a time, certain time goes, neither this training works, neither this maintenance approach works. And maybe after 16 years, so mommy asked me, "Ki, I didn't get these questions. Maybe 13 years back, nobody asked me this question that my child should do this. Otherwise, I would have been a very happy mother." So that's all about about these two approaches: maintenance approach and a training approach, which you will not find it on any Google or something. This is my terminology, Dr. Sumit's terminology. Okay. Let us understand what is the developmental approach. I'll explain in the first webinar. Okay, and it's there. I'm explaining it. Developmental approach in number of webinars I've taken in COVID and later on. So you can go through it. If any queries you have my number. You can ask us. You can definitely talk to us, because I believe after a certain age, I don't want to work on kids, but I want to work on the society. I want to work on the mindset where the society is going towards. Okay, so that's about the recap. We can recap means I have 25 minutes हो गए to express what is developmental approach. Developmental approach is all about there is a brain. I don't want to go in the brain. Again 2 hours will happen. These lectures are there. In the brain, there are different areas are there. The highest area what we human have is a cerebral cortex, in which lot of higher functions are areas are there, and to enumerate them, there it's memory. Memory is not memorizing. It is all about under keeping the incidences or storing those incidences, good and bad, in the way they are in our subconscious mind. That I call as a memory. It's not memorization. So memory area is there where we get a lot of information from our past, and then we try to work on our higher functions like communication. Like first, I will say orientation, like with place, person, object, situation around about self, about others. That is orientation. Then is the thought process, is the thinking. What thoughts I create in my mind when I'm getting oriented. I see a mango. What thoughts comes in my mind? I see my mama. What thoughts comes in my mind? Then thoughts. Then imagination. It's emotions. Decision making, problem solving, analytical thinking, creative thinking, reasoning, logical thinking. These are all the higher function areas because of which we are different mammals. We are different human. Human is different than other animals because of the cerebral cortex. These areas are in every human being. These areas are there, but due to certain reasons, these areas do not receive adequate information to develop, and this adequate information is very much same for a normally typical developing child also, and very much same for autism or severe autism or any kind of a developmental disability also. It cannot be different. Like autism, child's developmental approach is different, and normal child's treatment is different. Only there are two types of train. One is a fast train, and second is a slow train. But we have to be on the track that I discussed in the first webinar. Okay. So when we say the higher cortical functions, more they develop, more the child is going to be independent, more the child is going to develop the social skills, more the child is going to be a part of society. First be a part of family, then be a part of society. And more the child is going to be independent. So that's all. That's about developmental approach. To express this, I thought one of the parent asked me, "Can you please share this case studies you have in last webinar?" So I thought, let me express these case studies to you. So I would like to express two case studies where how we understood how we analyzed the child in a different stages of development, and how we created development in him by helping parent and child come together and be a efficient part of the family and society first. So allow me to share the screen. Actually, yes.
Yes, yes, it's on.
Can I share it? Yeah.
Yes, yes, you can share.
Can you see the screen? This is our CRM. Let me go to my one of those sectors.
Yes, we can.
Okay, I'll explain it from the online therapy services. What we are already doing. Somebody asked me about online therapy services. So mm, let me take you to Bhavesh. The few case studies I have found, there are all of them are like that, but few case studies for so that the parents can understand better. Now, Bhavesh is a 21 year 5 months old child. Okay. Now we call it the adult autism. The parents had come from Delhi. Somebody asked me, can we take this case from can you take us from anywhere? So I we can. This child came from Delhi. In fact, parent came first to us after listening to our webinars before. They came to Mumbai. Their concern was very much different, means very serious also. Both the parents came from the flight, met me, and went by night flight back to Delhi. The child's complaints were his self-directed and demanding behaviors, no problem. Aggressive behaviors, okay, few kids have, but his aggressive behaviors like does want to follow, okay, exercises. His problem was binge eating, okay, gets violent and may bite brutally if very basic demands are not fulfilled. Binge eating is all about उसको बहुत ज्यादा खाना खाना था, और अगर कोई भी खाना बनाया होगा तो पहले वो खा लेता था, और खाने के बाद जो भी रह जाता है, शायद वो रहता भी नहीं था, लेकिन जो रह जाता है वो फेंक देता था कचरे में. तो पेरेंट्स एक्चुअली स्टार्विंग, पेरेंट्स को एक्चुअली छुप छुपा कर वो सोने के बाद उसको खाना बनवाना पड़ता था और वो खुद खाते थे. दिस वाज द कंडीशन एट होम. One more thing, disclaimer: this don't get emotionally connected with the case parents, because I have seen parents quickly feel कि मेरा बच्चा कैसे होगा. No, this is just a case presentation. Come out of your autism family and let's understand what is it. Okay. So binge eating keep repeating demands and wants parents to repeat behind him. तो वो क्या करता था? Demand करता था. He used to create a demand and then I'll just make it big. Okay. He used to create a demand and then want he used to say कि parents ने वही demands को repeat करें and उसको follow करें. Now when I saw this, I could exactly see the mirror of the parents who were doing this with him before. For a few years back, I had this question to parents. Getting sexually aroused, that's not a problem. That is not a problem. At a 21 years, child getting sexually aroused is not a problem. Okay, for me, in a developmental approach, because he is a human being. Poor play and leisure line activity involvement, wants to go to toilet and enjoy jet pressure. ये बहुत सारे typical behaviors हैं. Made everything that nothing left behind. May hit car windows, getting aggressive at crowded places. ओके, तो यहाँ पर कुछ चीजें हैं जो आई कांटेक्ट तो था, बहुत सारी चीजें डेवलप थी, लेकिन वो डेवलप निगेटिव बिहेवियर्स के लिए थी. उसका हायर फंक्शंस अगर हम लोग देखेंगे कि वो 3 से 4 से 5 साल के बच्चे की तरह था. हायर फंक्शन में कहूंगा ओरिएंटेशन, थिंकिंग, इमेजिनेशन, वो सारी चीजें. बट ही हैड सम बिहेवियर्स. प्ले डायनामिक्स कुछ भी नहीं थे. ही वाज नॉट, ही डिडंट वांट टू मीट एनीवन. अगर एंजाइटी हो गई तो लिसनिंग म्यूजिक, अगर लिसनिंग म्यूजिक तो सो जाएगा, और नहीं तो फिर से द साइकिल वाज गोइंग ऑन. behavior's point of view, severe ODD is an operational defined disorder जिसमें child says everything no to if somebody is asked to him. Okay. Severe self-directed and aggressive behaviors, binge eating, does not leave food for others. Severe superego. Superego is all about I will no rules following, no rules, no social skills, nothing. Um, and there are many behaviors out there. On observations, we saw there are certain SI observations there, and based on this, we did certain tests in which certain tests we do unofficially. Like VSMS is supposed to be, it should be done till 15 years, but when we did it, the socialized come to 5 years and 4 months. Uh, Typically, developing child may, so VSMS cannot be done beyond 15 years, but in autism child, when we do it, because we don't want to diagnose the child, we just want to understand the child's developmental stage, so socialist and then impulsivity was very high, hyperactivity was very high. Same thing with the therapist scores. And Gillian autism rating scale is a wonderful scale that we follow to understand autism, not to diagnose autism, to understand autism in the child. That stereotypical behavior, communication, and social interaction, that all three things are from the parent's point of view very likely and has to be very likely because he was showing lot many different social interaction, communication dysfunctions, and certain unusual behaviors. Therapy score was also very likely where communication was coming in a very likely stage and social interaction was showing a lot of self-directed behaviors. So based on that, we started with the treatment with the developmental approach and where we saw that there were a lot of many behaviors, you know, which were coming because of parent child transactions. parent और child के इतने सारे सालों का ट्रांजैक्शन जिसमें पेरेंट्स ने थोड़ा सा पुश किया था जिसकी वजह से बहुत सारे बिहेवियर्स आए थे. We didn't want to say the child showing behavior. Most of the time, let me tell you, behavior is not a bad word. Behavior is a normal word. Behavior is anything, is my reaction. My reaction is a behavior. Okay. So, reaction to what? Whether my needs are fulfilled or not fulfilled, and how my needs are fulfilled. Based on that, I will create a response. That response is called as a behavior in psychology. Behavior is not a bad word. So his behaviors is because certain responses he has created due to what we saw in the online sessions when the parents and child was transacting with each other. There we saw the child and parents were operating from a lot of training approach and not many behaviors were given importance to control over there, even though he was a 21 years old. So in that, when we started working, almost after 2 months, almost after 20-25 sessions, we did have to work on a child first, we have to work on a parent first to make them understand what is the developmental approach. And हमें ये improvements मिलते हैं कि reduced aggression rates, frequency and intensity was reduced, improved parental understanding. First of all, it's very important, अगर आप कोई भी इंसान आपके सामने बिहेवियर दिखाता है तो सबसे पहली चीज है ये देखना कि how much I'm connected with that person, how much the child is connected with me. If there is no connection, then definitely negations will increase. So we saw that parent-child bonding was not that great. Parents now still they were thinking how I can improve his behaviors. Developing parent-child bonding, that he started giving social smile, he started giving he started showing basic interactions, which I call an improvement, not development. Based on that, we set certain goals. Now, these goals are very important. I wanted to show you. The goals are like, so he accomplished 18 online sessions. Today, parents are trying to follow parenting approach as per his functional level. So we keep certain goals, and this is very important to understand what is the developmental approach. Okay, I did not write over here that Bhavesh will stop playing with the jet spray and stimulating his private parts. I did not write Bhavesh will sit at one place and he will start writing or something, or Bhavesh will stop his certain behaviors. My goal was Bhavesh will show interest in parents' day-to-day functions. Need-based or non-need-based, parents will document 8 to different experiences that Bhavesh has started showing interest in them. Why? Because based on what parents have started showing interest in him. It's a give and take all the time in a developmental approach. Then Bhavesh will start helping mommy in cooking food. Since it was a food related, mommy used to cook the food, he used to eat and he used to throw and making and seeing the expressions on mother's face. So somewhere I saw that food is something is fixation. So what we can create is let him create the food, let him make the food, and how mommy can he and mommy can get along with each other based on his fixations. So based on that, getting raw food from the market, parents will document around 10 to 15, only 10 to 15 experiences in next 2 months I wanted. I didn't want a lot of change in all because everything starts from a little bit and we have to identify the elements of development in that little bit moments. You know, certain things were there that he will start making food by himself. To cut the story short, he'll make his own bed. So we wanted him to be independent. It was not so simple. This case was not so simple, and I would like to take one very important person's name. The therapist who treated him was Dr. Somil. Dr. Somil actually is an amazing adult autism specialist CRC has, along with other therapists. That he put his soul into that to make parents understand that it's don't look at autism, don't look at behaviors. It's about your child, and your child wants only two things. One is a joy, and second is exploration, which I explained in the day one webinar. Child wants or any person wants two things: exploration, and second is a joyful moments or happy moments. सिर्फ इन दोनों से लर्निंग पॉसिबल है, बाकी अगर ये दोनों नहीं है तो ट्रेनिंग ही ट्रेनिंग है ऑटिज्म चाइल्ड की लाइफ में. So let's move towards second review. I Second review happens after, let us say, now Bhavesh is 22 years. After few 1 or 2 to 3 months, parents are trying to follow, understand I call it as a mammalian brain approach versus reptilian brain approach because he was showing a lot of aggressions. So based on that, improvements were that he has the name is changed, had begun assisting mother in cooking. It's supposed to be Bhavesh, involving parents function day to day, need based and not need based. Parents had done few documentations, had made 1 or 2 step activities under parental supervision with respect to making food or helping them in day to day activities. Um, Began bed making in I do UC approach. I call it as a I do UC approach. Is Let me tell you one thing. There are two different approaches. Training approach is different. Learning approach is different. When you want to learn something from someone, you don't follow what someone is telling. You get inspired by somebody is doing. And especially children, they get inspired by somebody is doing. They don't follow what somebody is saying. And if the child is following somebody is saying, then it is a training approach. So child he started following mother with I do UC approach. Had initiated following various day-to-day commands, but reduced at present. But बहुत सारी चीजें थी यहाँ पर. मुझे बहुत ज्यादा डेवलपमेंट का धमाका नहीं मिला था, लेकिन मुझे एक चीज सबसे इंपॉर्टेंट मिली थी, that the parent had understood, okay, how to deal with him and how to make him behave like a dead son and not like autism child. फंक्शनल इन्वॉल्वमेंट हो गई थी, लेकिन थोड़ी देर के बाद रिग्रेस हो गई थी. शोज मल्टीपल इंस्टेंस ऑफ पॉजिटिव इंटरेक्शन एंड बिलोंगिंगनेस इन द फैमिली. इम्प्रूव्ड सेल्फ इनिशिएटिव सर्विंग वाटर टू पापा आफ्टर कमिंग फ्रॉम ऑफिस. ये बहुत इंपॉर्टेंट था क्योंकि he never he never had this kind of an interaction with father. The papa अगर ऑफिस से आते तो he started showing that belongingness to father, and every father wants this from their son. And this saw after many years in their son. He was doing it before when he was 4, 5, 6 years, but over the period he has lost the interaction and he has lost interest in parents, because parents are always pushing him to train something or to improve something, and nobody wants to see. किसी को भी पसंद नहीं है कि मैं कोई मुझे बोल रहा है सर हर वक्त कि आप इसमें improve हो जाओ, आप इसमें ये करो. Nobody likes that, and definitely because of that, many autism kids gets diverted to show negative behaviors. And I don't call it as autism. I call it as an affected transaction between parent and child. Based on that, we keep certain goals. Bhavesh will become compliant in certain areas, which Dr. Somin will explain them later on. You stop negative behaviors with parents with adequate fear towards parents' ruthless behavior. Now, somewhere I had to create, once the connection was developed, I had to create some kind of authority in the parents only for negative behaviors, but not the autism traits over there. Because I am a human being and I have all the right to save myself, to to protect myself, and where parents, under the name of love and all, becoming the victim of his negative behaviors. So there we have to create some kind of a parenting approach we have to give, where Bhavesh will understand that he stays in their house and not they stays in his house. So somewhere behavioral approach was discussed. Um, yeah, but एक important चीज था, Bhavesh will develop fear of separation. Fear of separation is all about I cannot live alone. I cannot live without my parents. And this is a basic ideology behind any love and we can say respect. I believe this because until I don't fear that I will lose that person, I will not give respect to that person. So that's more important, that he will develop adequate fear of separation, that I want mama around, I want papa around. Previously, what was happening? I just want to be alone in my own world. Let papa and mama before me. And a lot of time went in this case, but over a period, we saw around, let's say, phone review, we saw Bhavish started showing improvements and reducing the things that student talks, transactions, cooks basic food with minimal assistance for others, but may or may not share, serve them. He had at least started making the food, लेकिन वो serve नहीं कर रहा था उस वक्त. Started making popcorn, lemon water, शरबत स्कूल. ये यहाँ पर दिखाने की ना, बोलने के लिए क्या इसमें क्या बड़ी बात है कि लेमन जूस बनाना, मेरा बेटा बना था. But at the age of 21 years, where he had developed lot of negativity in his this things. This is possible with the developmental approach, in which parent and child connection, parent child bonding is more important. When parents are getting involved in their leisure time, but the regularity and frequency. Also ask parents should live their own life. In developmental approach is all about parents should not become an autism parent. He has his own life, she has his own life, she has left. Sir, I have left my job. I am not doing anything in my life because I just want to have my child and अभी वही मेरी दुनिया है. ये जो parents बोलते हैं ना, इनके बच्चे कभी भी डेवलप नहीं होते. ये मैं बहुत ही समझ कर बोल रहा हूँ. लेकिन जो पेरेंट बोलते कि मेरी लाइफ है, ओके, चाइल्ड is just 5% in my life. Okay, he has his own life. I have my own life. I will not change for him. Okay, but I have developed a culture. I am experienced. I am living in a way. The child is supposed to follow my culture. For that, I will do everything so that he will be a part of my culture. I will give him love. I will give him everything. People who try to move towards autism and try to behave in autism manner, autism is a very difficult disorder to treat then. So it's not, in the developmental approach, it's not about becoming an autism parent, but become a parent of a developmental delay child. Okay, my child is 8 years old, okay, my child is 21 years old, but he is behaving like a 5-year-old child. Let me transact him with a 5-year-old child. Um, Okay, so I would like to show another case over here. Yeah, I would like to take 1 minute of yours. Yeah, please. Actually, जो सर कह रहे हैं, I mean many of them asking that हिंदी, so जो सर कह रहे हैं वो मैंने खुद एक्सपीरियंस किया है. Like ये जो exactly सर ने बोला कि मैं ऑटिज्म ममा हो गई थी, उसमें मैंने सब अपना काम धाम छोड़ के बैठ गई थी. एंड द सेम थिंग वाज देयर. तो बस बच्चे कर रही थी, बट कर कुछ नहीं रही थी. बस मैं इधर उधर लेके जाना है, टेंशन में भागना है ये, एंड सेम थिंग एक्चुअली आई वाज डूइंग. सो कैसे मैंने अपने आप को, आई मीन ये लॉन्ग जर्नी है, बट कैसे मैंने अपने आप को उस मोड से इस मोड में लाया है विद द ऑल गाइडेंस फ्रॉम सुमित सर एंड होल टीम ऑफ CRC, वो मुझे पता है.
So if parents are really appealing, मतलब as a mother I'm appealing कि आपको अगर कुछ सेकंड ओपिनियन या कुछ ये चाहिए सर का तो सर से जरूर कनेक्ट करिए because that changed my life and my both kids' life. Yes, sir. Please, sorry to disturb you. Please continue.
So thank you for those words, Anjali. So the second case I would like to express you is a Shreeya child's these things. She had come for a very short phase, and let me express it. Is this screen visible to everyone?
Yes, yes.
Right. So now this is a different case where come from Nasik, and she was 9 year 11 old month, 9 year almost 10 years old girl, and major concerns were detected autism in Aurangabad. Did many testings, um, genetic testing, and many things, many treatments she was following, medical and all. But social communication really poor, super ego self-directed. Most of the time, question answer based communication and thing was developed where the child was will speak only when parent will ask the question. And that I believe if there are 44 parents, then at least at least 30 parents are going through this. That when I ask a question, then the child answers me. And assuming that is a communication, but that is not a communication. So we are going to have a very special, different kind of a webinar on this. I would like to take like how to develop communication. What is the difference between communication, language, and speech? I've already taken in the past, but there are more advancements, so I would like to take you to that level. So trained question and approach based communication. Here, Shreya was giving eye contact, but it was more need based response, and her receptive communication was like 2.5 years to 3 years. So, but social interaction point of view, she was giving answers based on parents' urge, but otherwise, social reciprocity was not that great. Although she had some kind of curiosity to see other kids play, but she was not involving in those kids. Poor play dynamics were there. You know, loves to see pictures in a paper textbook, and also behavior's point of view. Severe impulsivity, over talkative, makes body tight if excited. The talkativeness was non-meaningful. Severe lag in superego, ODD, tendency to scratch, right thumb, or something like this kind of a behavior she had, and because of that she had, like, she had almost injured her this thing. So to take her, I, I'm a bit stereotypical in showing everything. Um, we did a testing at the age of 10 year 1 month. In 2 months of observations, we do a testing. I always believing testing should be done after adequate observation sessions with the parent, where where with the chronological age she was 10 years 1 month, but the social age was she was something like 2.5 year. Um, and Gilliam autism rating scale point of view, the autism index was very likely because age gap is so much. Child is 10 years old and social age is 2.5 years. Since there is a lot of age gap, and at the age of 10 years, you require a lot of development. So then autism index will definitely fall towards severe category. You know? Uh, Same thing with the therapist score also, where communication was lacking a lot, and very likely stage of autism she was showing. When we started with the first review, she was 10 years, 3 months, almost three months we took her first review. And in that, we enumerate her strength and weakness. And let's see improvement. I would like to enumerate the improvements over here, that the parents are able to understand her needs, inner drive, challenges, and trying to mold self as per requirement. Here, it was we were not treating Shreya, we were treating parents, because somewhere parents have moved towards autism treatment or autism maintenance protocol. We wanted parents to come towards developmental approach. So somewhere we worked on parenting where we changed the parent to make then judgmental, rather than being judgmental, made them understand what can be the need behind that behind that negative behavior or behind that a particular trait or habit. You know, we saw improved parent-child bonding in 3 months, developing impulse control, developing imitation and onlooker play. She started imitating play and onlooker play. Onlooker play is all about जैसे मैंने पहले बोला कि she was happy to see kids but she was not playing. But by 3 months, 10-year-old autism child started playing same games at home with parents. Based on what passions, based on what play she saw in the garden, in the ground, or outside in the society. So there the child and parent came together, to share the passion, to share the joy, to share that exploration, what she was doing with those kids, what she was liking, but she was not understanding how to go over there. Many sensory issues were there, which we worked eventually, so that she developed her interaction ability, able to grasp content of thought process and use it contextually. यहाँ पर ये सबसे important चीज है. Shreeya developed and Shreeya improved. Shreeya started speaking many words. Shreeya started speaking sentences. ये यहाँ पर मैंने नहीं enumerate किया है. यहाँ पर me and my team has enumerated. Shreeya started understanding others' thoughts. कि what exactly parent expresses their intention, what exactly the parent expresses their thought behind that conversation. It's like I mean, I will not say it here. Definitely, I will share it in the uh, next webinars about communication. So that thought process, she started understanding, and communication is all about how I transfer my ideas, my beliefs, my thoughts, my emotions from my mind to another child. Where the same intentions will pass on to another person. Communication is not about how I transfer the words and sentences from and answers and identification from my mind to another mind where another person will be very happy to clap that I spoke. That is not communication. Okay. So it can be verbal and non-verbal. And autism is not a speech and language disorder. It is a pure communication disorder because of n number of reasons. And one of the reason is parent is moving towards maintenance and training approach. No? One or two episodes of independent peer interaction in the school while serving midday meal we saw. And whenever we are treating a child, the small instances are more important. They give you a path. It's like, we are going in a trek, and then small arrows are there. They become the pathfinders so that we can move in that jungle. So these small incidences the parents are supposed to note down to understand what exactly child is doing, and the developmental approach therapist will guide you ki what was there behind it and how we can enhance it. Last webinar I say that every matter is made from the small molecules or atoms. If you are able to create one molecule of that matter, then you can create a big matter of it. I hope you understood that if you are from chemistry or science background. But don't try to create a matter. Don't try to create the big object. Try to create the small aspects of that object and start adding elements in it. You will start adding more and more molecules in it, and you will see the big object or objective of your development. Um, Home environment point of view, here we accomplished 35 online sessions till date. Clients have begun to connect with her based on play and communication approach. This is a very unique approach at CRC. What we follow is a play and communication, where child's occupation is play and parents' occupation is communication. And they transact from that. So they still need to regularize the sensory diet protocol. For two, they were calling her as a co at home. Goals were like goals are not that Shreya will reduce her negative behaviors and all, but exactly opposite to it, Shreya will try to seek positive attention of the parents, because attention, be it negative or positive, attention is something like a seeking acknowledgement, and it's a basic need of everybody's or every intelligent brain. Seeking attention is very important. Seeking attention is there in the trees also, believe me. Okay? I don't want to go to that level, but every person, every animal, every living organism has a potential seeking. And it cannot be negative. It is eventually become negative. Okay? And how we can convert that negative attention into the positive acknowledgement seeking, that was more important over here. In this goal, Shreya will express her generalized orientation in day-to-day function. As I said, the first cortical input is orientation with respect to place, person, object, situations, actions happening around. Maybe देखकर, सुनकर, touch करके, taste करके, smell करके, through my sensor systems, how I am gathering that information. I am creating the orientation about things happening around, and how I create it as a raw material to develop my thought process, my imagination, and communicating through that. So it's all about developing orientation in day-to-day functions. Very small elements we wanted over here from parents. Um, uh, she will start expressing orientation, that whatever she's expressing orientation, what she's experiencing, we wanted her to express it in various sounds in daily transaction. We didn't want her to speak doggy, we wanted her to speak bobo, because that was her auditory orientation. You know? She will follow two commas at a time. This was more of a developmental. I will not go more into it, because this is a very individualistic goal. She will become a very good helper while taking baby's care. She had one sister, and she had some issues with this thing, because of the care and love issues, parents transaction. So we wanted that she should start taking the care of a baby. Eventually, we saw wonderful results over here later on. So Shreya will use her daily experiences with doll and Teddy during play. This is something, a play which we wanted, a small aspects of symbolization, where whatever is happening with her, the parents and she will experience it in a doll play. So something like this. This I would like to call it as a developmental approach. It's already 8:30, so maybe I wish I could show you one more case. Do you want to see one more case, or we can stop? I leave it to you people. I think
Yes, you can put it in the chat box. Because, yes, one more case, somebody is saying. Okay, just wait. Yes, one more, they want to go for it. Okay.
यहाँ पर लिखा है, सर आपको सुनकर बहुत अच्छा लग रहा है, काश मैं एक गाना गाने वाला, काश मैं एक सिंगर होता. Okay, but believe me, when I hear my own webinars, I feel like whom I'm hearing. But thank you for that acknowledge. Thank you for all those words. One more child I would like to show over here. Um, many recommendations from my therapist. Okay, I'll say it. Yeah. Now this is child M. Akhilesh from Gurgaon. This again a OTS online therapy sessions he was taking with us. We have a specialized branch for OTS, where it's a completely different branch, completely different therapists, different skill sets, different approaches, because we are not going to touch the child, so we are going to work on a parent. But yet, it's an amazing way we can create developmental approach over here, because development can happen only between parent and child, and that's very important. Um, Chief complaints were expressive communication was impaired, child-directed behaviors. His major concerns were affected auditory modulation. Was not. He was a bit sensitive to sounds. He was showing adaptability issues in a crowded places, affected awareness about safety and danger due to affected environmental orientation. This is something very important that parents are afraid of, कि मैं अपने बच्चे को बाहर कैसे भेजूं सर, कि मुझे गाड़ी आती है, इतनी सारी चढ़ जाती है, तो मैं तो उसका हाथ भी नहीं छोड़ना चाहती हूँ. तो इसके लिए, और और ये फियर, डर होता है 3.5 4 5 साल में, लेकिन पता नहीं चलता है कि वो 20 साल हो गया बच्चा, लेकिन फिर भी अभी वो फियर उनके माइंड में है. शायद बच्चा उससे बाहर आ गया है, शायद बच्चा एक्चुअली, लेकिन बट वी डोंट गिव अपॉर्चुनिटीज टू द चाइल्ड. Somewhere the safety and danger was an issue, and this was be a more difficult I felt for the developmental approach. may become submissive in front of autocratic authorities. Like कोई भी अगर बड़े आवाज में बात करेगा तो used to become submissive and used to follow. But I wanted the child should not become submissive. Child should have a one-to-one approach with everyone. वंडरफुली शोन इन सितारे जमीन पर, बट वहां तक पहुंचने के लिए बास्केटबॉल की जरूरत नहीं है। वहां पर पहुंचने के लिए जरूरत है कि वो बच्चों का ओरिएंटेशन कैसे डेवलप हुआ, वो बच्चों के हायर फंक्शंस कैसे डेवलप हुए, हाउ दोस किड्स आर लेफ्ट अलोन बाय द पेरेंट्स फ्रॉम दिल्ली टू मुंबई। उनके पेरेंट्स नहीं आए थे लेकिन वो अकेले वो गए थे। बच्चे को अकेला छोड़ना जरूरी है। और एनिमल्स और ह्यूमन में एक ही फर्क है। मैं ये जानता हूँ अबाउट अबाउट पेरेंटिंग कि अगर एनिमल्स में अगर बच्चा वीक है तो उसको जितना ज्यादा चैलेंज दे सकते हैं उतना देने की कोशिश करता है वो एनिमल मदर। लेकिन पेरेंट में अगर कोई बच्चा वीक है, सॉरी ह्यूमन में अगर कोई बच्चा वीक है तो पेरेंट विल ट्राई टू केयर अ लॉट ऑफ दैट चाइल्ड। एंड आई हैव सीन इन ऑटिज्म दिस केयर has created a lot of damage in many kids. I'm not saying punishment, I'm saying care, I'm saying assistance, I'm saying fear. Fear is not about child's behavior. Fear is my own वो मेरा खुद का कायदा है। मैं fear को लूं, जरूरी नहीं है कि वो वैसा ही हो वहां पर। No, but because of my fear I'm not giving opportunity to child, I'm not coming out of that shell of stress. That is something very important that every parent should understand when we are operating from the developmental approach. uh, because अगर आपके माइंड में फियर है तो आप कहीं भी डेवलपमेंट नहीं कर सकते। बीट अ टिपिकल चाइल्ड, बीट अ हस्बैंड वाइफ रिलेशन आल्सो, इफ यू हैव अ फियर इन योर माइंड एंड यू आर ऑपरेटिंग फ्रॉम सम काइंड ऑफ फियर, यू ट्रांसफरिंग दोस इंटेंशंस टू द हस्बैंड, you know that something is wrong, something is this, and you are not a real person over there, and husband will actually behave differently, or husband to the wife also, or friend to friend also, everything. But autism में मैं एक चीज आपको बोलना चाहूंगा, थोड़ा सा इलाबरेट हो रहा है यहाँ पर, that autism child बोले या ना बोले, whether he's speaking or not speaking, that doesn't matter. Whether he's interacting or not interacting, that is not a problem. Whether he's playing, he's going to school, he's reading, writing or not writing. But every autism child is well versed with one thing, that they are very good at receptive intention. I repeat, they are very good at receptive intention. Receptive intention is about रेज योर हैंड्स और राइट इट इन द चैट बॉक्स कि जब आप आपको लगता है कि बच्चा अच्छा कर रहा है अभी, यू नो तो आप जब बेडरूम में जा रहे हो तो क्या आपके बच्चों को समझ में आता है कि नहीं कि मम्मी अभी बेडरूम में क्यों गई है, शायद अभी भूख लाने गई है, शायद अभी वो मुझे खाना लाने गई है, शायद वो अभी अंदर से कुछ ये करेगी। So many of you realize that child actually understands what you are going to do next. Please put it into the chat box. Yes or no? That my child understands me very well. He is very much aware of me कि मैं अभी क्या करने वाली हूँ, अब मैं क्या करूँगी, अगर वो ऐसे करेगा तो मैं, yeah. So that I call it in the developmental approach is a receptive intention. Child is well aware of you, and if your intentions are more judgmental, your child will believe me. You give the best chocolate in the world, you give the best approach in the world, child will not follow you. And when I say intention, intention is all about the real myself, real me, who I am. Even if I'm backing a child, even if I'm angry on a child, but even if I'm loving the child, even if I'm doing any kind of a thing, I'm not happy with the child. Are these intentions coming real from you, or from your judgmental, or from your training, or from your maintenance based approach? If they're coming out from the training and maintenance approach, child will run away from you. Comment no if you don't agree with this. I believe everybody will agree because child understands our intention, and that is a very important thing. I'll be taking in the next few webinars. That's a very important link that how we can connect with the child. So the adaptability shows in a crowd basis. So coming back over here to Akish, who's a 7.5 year old child. Um, hitting mother on face if his demands are not fulfilled. This was something very wrong, and I don't like this. I never liked any child is hitting his parent. I never liked it. I don't know how parents take it. If something happening brutally to me, I have seen many very weird cases in my life, and I used to not feel pity for the parent, but I used to feel very angry on the parent and how you can take that behavior. So that's not love and that's not care at all, and that's not autism treatment at all. So somewhere he was showing this behavior, same kind of expressions I had on that parent, and how can a child, how it's not child is hitting you, it's you are allowing the child to hit you. It's you're allowing the child to pound on you, allowing the child to control you. And every human being is is born to control others. How he controls to develop something, to create something, or to destroy something. That matters a lot, and that's something is a transaction between parent and child is very important. Yeah, few common behaviors were there which are socially not acceptable, like rubbing private parts and all. I believe they are not autism; they are something normal physiology. We need to understand the physiology. We can overcome it. To cut the story short, I will go towards the first review. I will not go towards testings. This is something now in within 1 month we do his review. Here, I would like to take one more amazing therapist named Dr. Rosa Ramani. She's regional head of our Thane branch, Thane region and Mumbai region. But it's amazing therapist who actually can treat adult and unresolved autisms. Improvements were like, I think there are few improvements are gone under it. This things, but approach changed towards Akhilesh. Parents' approach was changed towards Akhilesh. It's not Akhilesh is improved. Operating through his needs and bonding through play, improving sitting sustenance, improving awareness. Now, sitting sustenance is all about sitting tolerance. Achilles started showing inner drive that he was sustaining an activity, or he was sustaining some play, or sustaining some kind of interaction for more than 2 to 3 minutes. Okay, developing separation anxiety was this is my very favorite word. Separation anxiety. Don't take it from psychology. I should call it the fear of separation, but it's like separation anxiety. Fear of separation should be there, and if the autism child is showing fear of separation, that means he is developing social interaction, which is a developmental approach. So, imitating gestures. So goals we keep, I would like to show you your goals weekly. Keep that. Akhilesh should engage self in meaningful play based on use of objects, like how he uses these objects, how he develops the objects schema in the brain, how he plays with those objects. There are many people in the maintenance approach, in the training approach, they say toys are not supposed to be given to the child. I don't believe in this. This is something you're taking away an important pillar from the child's development, that is play. You know, it's very important because toys are really important. They are there since inceptions of it's there since their thousands, I mean lakhs of years. Play creating joy is very important. And toys, I believe, is a very important mediator in that aspects. And you will seek appreciation and completion. It's not about it's not about parent will tell him ki very good. He will say ki, okay, you say I have done something great. See mama what I have done. See papa what I have done. It's not necessary to that he should say that what I have done. Like he will look at the father expressing like, okay, you are looking at me, something like that. Public will start using 15 to 20 objects at home. At least will show more involvement in parents' day-to-day functions. Some goals are something related to the stages of development, and believe me, this when we went to the third or fourth review, I'll show you the fourth review, and I'm just randomly opening. The therapist has given me this kid's names. Uh, uh, Now he's 8 or 8 months. Goals are actually like able to understand verbal reactions and reciprocations accordingly. It's not about only intention, but now what parents are saying, whether they are funny, whether they are thoughtful, whether they are sharing some kind of emotion, he's become more understanding towards it. Started making lots of swaras about speech, able to identify 15 different sounds and associate with the pictures. Okay, this is more of a okay. There are few things I like training also, because few things we want to uh, see that how the child is doing in that particular aspects of development. No? Occasionally calls mom and sister. Occasionally uses meaningful sounds. Goal like Akilesh will comply or we habitat in different social gatherings and situations. Like once upon a time, he was showing a lot of negative behaviors on completely negative in the going in social situations. He will actively watch movies in the movie theaters, be a guest in birthday parties, be with mommy in various shoppings, visiting relatives, play basic games. I would like to stop this fourth review and I would like to go to the fifth review. Let us see what happened in the fifth review. I don't know what happened. It's not like fifth review. Okay, this everything is happening online. These things. Okay, the fifth review goal was achieved. Akhilesh is now 9 years and 7 months. Okay, we started complying better in social gatherings and different situations, especially visiting relatives, restaurant, mall, birthday parties, etc. Goal like partially achieved initiated playing with other kids with games with one or two basic rules. Although he started passionately following kids, but he was not understanding rules. But this time he started following basic rules. And this too, we started with this child at the age of 7.5 or 8 years, but now, so that's why I said you start any stage of any deviated person in the life. If you I said deviated person. I did not say autism. If you have a right transaction, if you have a right approach, I believe every person can come back to his normal life, and that's something is a developmental approach. Um, few of speech based goals were there. Able to hold paper on wall and something. Certain things were with respect to more physical motor skills and certain cognitive skills, but it's all about okay, there was one goal that he's able to visually copy the pictures but unable to draw by himself. And this is something which is very important for us, that to take it this thing, the goal was not achieved but the goal gave us something he is able to draw, but he is not able to imagine the shape of that particular draw. Like if I say pencil, that pencil comes in front of our eyes, that was not coming. And somewhere in the sensory motor stage, Akhilesh was did not develop that stage. So here we took him back to the sensory motor stage of development, worked on it, and started healing him. So if n number of examples are there, I think in my CRM there are more than 5,000 cases. But um, something very important when I say retesting, we have to retesting. Okay, reassessment we have done, because after 3, 4 reviews, we should do reassessment of the child, that where we stand. Are we stagnant? Are we going ahead? Are we going back? It's more important. Now Akhilesh is 9 years, 8 months. Um, okay, now see, when we started, he was 8 or 9 months. Social age was 3 years. At the age of 9 years and 8 months, like let's say 11 months, uh, I don't want to know whether the autism is developed or not, autism is improved or not. I didn't want to see the autism at all. I just started connecting with a 3-year-old child, and now this child is maybe like a 4 year and 3 months old child, with lots of outcomes where the child has started understanding the family environment, social gatherings, social environments, started adapting in the environments. And a very wonderful thing, I remember the mother said that, I found my child. I started finding my child. Uh, uh, in Akhilesh now. I started enjoying the motherhood in him, because I have changed. I didn't change him. I have changed towards the developmental approach, and this is amazing. This is amazing. Uh, you know, outcomes what we professionals get or we get at CRC, which is amazing feeling. These things. Post assessment, this thing hyperactive is completely no inattention was not there, because parents have. It's not about hyperactivity or ADHD. It's about, I would like to say, give what is the rating scale now. Okay, now previously the stereotypical behavior was possibly, and when I discussed with the team, Dr. Rosa, that sir, stereotypical behavior is not there. Only communication, social interactions are affected. Somewhere I believe that parent and child bonding, if we work, we can do wonders over here. And same thing happened. Post assessment intervention. Stereotypical behaviors we work, definitely we work on it, but communication and social interaction went to possibly and unlikely. See, this is an amazing result. We will not. I'm not expecting this every child, but somewhere this child is amazing outcome, where because the parent were only working on maintenance and training approach, that's why there was a deviation. The child had completely disconnected from the child, hitting the mother on the nose, hitting the mother, not trying to connect with the mother, and because of that, mother was not could transfer her ideas, thoughts, beliefs, उसकी पूरी जायदाद जो बच्चे ने जानी चाहिए थी, जो 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 कल्चर वो मम्मी पापा का उसकी तरफ जाना चाहिए था, हाउ टू लिव इन द सोसाइटी, their thoughts, their imaginations, their experiences they wanted to transfer to the child, they were not able to transfer it because they were actually working on autism treatment, maintenance approach, and training approach. And when we worked on parenting, when we worked on the same, without touching the child, I never saw this child in one-to-one phase. With this child online only, with an amazing developmental therapeutic approach, we saw at that moment, I will say, at that moment, autism index was unlikely. And we may say the parents are a bit more उन्होंने थोड़ा सा बहुत ज्यादा overwhelming हो गए थे because in short time lot of development was there, but here we say that we have to continue working on the same thing so that things, and therapy score was yes, possibly it was 68, like 69 होता तो शायद possibly होता, but 68 है तो वो unlikely हो जाता because anything beyond 69 in GARS is autism. Okay, so this is something parents overwhelming condition because they never saw the child was like that. But now here they started seeing an amazing child in that autism, not autism into child. And this is all about a developmental approach. I would like to conclude over here and stopping this sharing. This is about a developmental approach where where it's not about finding autism and treating autism in the child. It's about finding child in the autism and developing that child. So thank you for your patience. Thank you for attending. Thank you, Ashali, for calling me. I believe we can end this particular three parts about different treatment approaches like maintenance approach. I hope parents have understood what is maintenance approach, what is training approach, and third thing is what is a developmental approach. So if I believe this will help many of you. And I have seen in my live webinars, parents have changed, parents call me, parents call us. One talk changed me, one word changed me, one phrase changed us. And that's why I believe that, I believe that I'm thankful that Harshali is calling and I have started this webinars again. Thank you everyone. Thank you, Harshali. Thank you so much, sir. I mean, this is a lot of knowledge we are gaining, and parents are coming up with more in coming Fridays. So stay tuned. And I'm posting some feedback form in groups, so please fill up those. So it will help us to understand that what you all need to learn, or what are your thoughts about it, so we can help you in that. So thank you so much for being here. Quite attentive and very nice, sir. I mean, thank you so much. Words are less. If you want to connect us, the number is given for anything. Yes, yes. You want. Yes, number is given in the chat box, but I would like to repeat once. The number is 92215 33719. 92215 33719. Right? Or you can connect me anytime. I would be happy to help you. Thank you so much, sir, and thank you so much, parents. Thank you. Good night. Good night.